guys, Midwife Nala here and welcome back to my channel. I'm so happy to come to you guys today with another video. Today this video is going to be about a product review, specifically a stethoscope. So if you're interested in getting a new stethoscope, you need some reviews before you purchase it, you make that investment, then keep on watching. So the stethoscope I'm going to show you today is a stethoscope that I actually got from my cousin as a graduation gift from graduating with my master's in nurse midwifery. And this is the stethoscope. It is the Littmann core stethoscope. And baby, let me tell you, this right here was a really good gift. I was like, traditionally, I think when people graduate nursing school and or get like, their nurse practitioner license or whatever, which is like a form of what I have as a midwife. I'm technically a nurse practitioner, just specializing in midwifery care. People get stethoscopes as gifts, right? And so I had one already from when I graduated nursing school. That was a pretty good one that my husband bought me. And so I wasn't expecting this gift, another stethoscope, as a gift for when I graduated midwifery school. But I'm so thankful for it because I was like, well, would I really need a stethoscope like that as a midwife? And it's like, well, kind of, sort of, right? Yes. When you have a new OB or an annual exam, you still have to listen to people's heart and lungs. But I'm like, well, my stethoscope that I currently have, which I think is a Littmann Cardiology 3, if I'm not mistaken, or 4, if I'm not mistaken. I think it's 4. Does the job for that. So it's like, well, I don't need anything fancy. I don't need anything fancy to where I could like amplify what I heard and record it and re-listen. But this stethoscope has come in handy a lot. So I currently work at a very high risk labor and delivery floor. And even though I'm a midwife, I take care of very sick patients. And so some of the patients I take care of that are sick end up having like preeclampsia with severe features. And anybody that knows what preeclampsia is with severe features knows that they're at risk for having like fluid buildup in their lungs. And so typically if someone has preeclampsia with severe features, they're also on magnesium throughout the duration of their labor course and then 24 hours after they have their baby. And so we have to do things called mag checks. We have to see if they have mag toxicity. And, we have to like screen them for mag toxicity, ask them a couple questions, shortness of breath. Are they seeing or if their preeclampsia is worsening, do they have a worst headache of their life? Is it in the base of their head specifically? Are they experiencing like blind spots in their vision? Are they having epigastric pain? Are they having any pain in their upper quadrant? We're checking their swelling. We're checking their urine output for sure. And then we're also checking their reflexes. But we're also listening to their lungs. I always listen to their heart because I can't just listen to your lungs without listening to your heart. But we're listening to their lungs to see if they're having any fluid retention, which is a sign that, the magnesium is possibly not working. But anyway, so I don't have my stethoscope in this box anymore. I actually use it. So I just have the box because I keep it. Oh, my old stethoscope is in here. I just keep it in there. I like to keep the boxes. So my new stethoscope is in here. And it looks like this. Okay, so this is what it looks like. So like the little earpieces, it's like the same. My cousin had it engraved and it says, oh, glory to God. And then it has like this little apparatus thing with like a charging port and then these little buttons here. It's like I guess a minus, a O, and then a plus sign. And then this little thing that if you click lights up, and then like the bell and stuff. And then on mine it says Nalamaro CNM. And so it comes with a charger too, which looks like this. Standard charger. That's what it looks like. If y'all can see, looks like that. So that's the charger that it comes with. And it comes obviously with extra like earpieces and all the other stuff. So this little thing right here, amazing. Amazing. When I press this little button here and get this lighting up here as I'm listening to someone's heart and lungs, it is so amplified. I could hear everything. I have not, you know, knock on wood, you know, listened and actually heard something abnormal, because I'll be quite honest, what am I doing with someone with abnormalness as a midwife? I don't know. Obviously, if I hear fluid in the lungs, that's something I would have to like talk to a doctor about. Hey, I think I hear, you know, fluid in their lungs, or they really sound short of breath even though they're not reporting it. Their lungs sound off. But it's amazing. I 10 out of 10 recommend the stethoscope. I feel like, especially like as a new learner, listening to heart and lungs, like there's always that meme that goes around. I'm sure you guys have seen it, where it's like, you know, you're like, you have the person like has their eyes closed, they have their stethoscope in, and they're like trying to listen really hard. And it's like, wait, hold your breath so I can hear. And it's like trying to listen if anyone's talking in the room, if it's loud. Sometimes, definitely if the patient's talking or whatever. It's sometimes very hard to listen to what you're hearing or whatever. But this stethoscope, you have no issues with that. It takes all the guesswork out. You can download the app, which I don't have. You can look up, when you download the app, you can link it to the stethoscope. You can like link the stethoscope to your phone, and it records like whatever segment that you're trying to record, which I think probably is what these buttons are for, to be quite honest. I just don't use that feature because I don't need it. Maybe if you're like a cardiologist, right, and you want to re-listen and have like a little short segment, or maybe you're someone who's listening to something and is like, this kind of sounds off, but I don't know what I'm listening to. You can record that segment and then send it to someone else via like a HIPAA compliant, safe like messaging system. That's probably like a good idea. I don't do that. I don't need to do that. If I hear something weird, there's people around me, so I'm like, hey, can you come listen? Also, because I hear this, let me know what you hear. So it's really cool. And so 10 out of 10 recommend the stethoscope. I don't know how expensive it is. I can put that on the screen for you guys. But if you're thinking about getting a stethoscope, unsure which one to get, or you're thinking about this particular one and don't know if it's worth it, I can guarantee you it's worth it. Go ahead and buy it, or convince someone to get it for you as a gift. You deserve it. All right? So until next time, guys. Bye.